the issue is that time doesn't stand still. Maternity services have not improved in the last 2 years. And my concern now is, can one person actually fix this system? Where indeed I think it needs concerted, timely, urgent action from Secretary of State right down to the ground.
Now, an inquiry into the NHS maternity system in England, chaired by Baroness Amos, has recommended that doctors should be forced to work night shifts and weekends to help end a deadly cycle of NHS maternity scandals. Baroness Amos's report is littered with examples of what's described as medical misogyny. Women giving birth were ignored, some described being denied pain relief or being told they were a wimp. However, one of Baroness Amos's advisors, Dr. Bill Kirkup, has resigned. He's understood to have disagreed with her over the finding that a push for what is described as a normal birth, including denying women caesarean sections, was not prevalent nationally. Another recommendation is that the government appoints a maternity commissioner. Already the midwife Donna Ockenden is being suggested for that role. Her own report into a maternity scandal in Nottingham was released last week, and she's also reviewed failings at Shrewsbury and Telford hospitals. Donna Ockenden joins us now. Good morning.
Good morning.
Thank you for joining us today. Your report last week was really shocking. We talked about it a lot on the programme, and it prompted many of our listeners to get in touch with their own stories. We now have another report into the national picture in England by Baroness Amos. What do you make of her conclusions?
So what I would say is I'm really grateful to Baroness Amos and her team for gathering together all this evidence. But I've looked at it overnight and I don't see anything that we didn't already know, that hasn't already been spelled out very clearly. And so what we need to do is get on and fix the problem.
And how do we do that? I mean, some of the recommendations in this report are things like doctors working night shifts and weekends in maternity care to prevent mistakes, the appointment of a maternity commissioner. I mean, do you look at those recommendations and think, yeah, they'll make a real difference?
No, absolutely not. I mean, let's just look at perinatal workforce. I speak to all kinds of doctors up and down the country every single day of the week. We know that we've got significant gaps in medical rotas in most trusts in the country. Since last week, when my report was published, I've been contacted by resident trainee doctors across the country who are saying, we don't think that we can even complete our training now. So we've got a real risk that people are going to walk away from obstetrics and midwifery. So adding extra responsibilities doesn't seem to make any sense to me.
I mean, I suppose the biggest question here, given what you're saying, is then what change does the government need to make? Because we had the Minister on, the Health Secretary, who said, yep, there's a culture of cover-up, of bullying. And he said that in a way that, as if that would be a normal, accepted thing to say. That is incredibly stark. What does the Health Secretary need to do to fix this problem?
So last week we heard about the plan for 6 months to create an action plan. I said then that was absolutely unacceptable. We don't have 6 months. We don't have time on our side. I think we have to have a renewed focus on listening to women and families. It has to be at the heart of everything we do. But going hand in hand with that is one of my key actions, not recommendations, which is around a perinatal workforce plan. Everyone who needs to deliver safe maternity and neonatal care needs to be brought into the circle, and everyone needs to be listened to, and this has to be properly funded.
I imagine, Donna Ockenden, listening to you speak, that you will have made those points quite clearly, possibly even repeatedly to those politicians in charge. Are they listening to you?
I think that at the time Shrewsbury was published in May 2022, we had the Right Honourable Sajid Javid MP in role as Health Secretary. I think if he had stayed, I'm absolutely convinced we would have made better progress. But where we are now is, I think there's a real risk we're still going backwards. Maternal deaths increasing, stillbirths at a higher level than before the pandemic. So nowhere near enough progress is being made. and loading further pressure on frontline doctors and midwives is just not going to wash.
I'm interested that you are quite critical of this report. Dr. Bill Kirkup, who led the Morecambe Bay inquiry, he's resigned from the panel of this Amos report because he says he's worried about the conclusion that the push for a natural or a normal birth is not relevant or not as widespread a problem as he believes it is. He's a man with great experience. I'm sure you know him well. He said that this report is a whitewash. Is he right to be concerned?
So I have known Dr. Kirkup for many, many years. I mean, in our Nottingham report, we talked about a normalisation of deviance. We gave lots and lots of examples in Nottingham, but I do believe it's a national issue, where women were denied caesarean sections when they begged for caesarean sections, with often tragic circumstances and tragic outcomes as a result of it. I think it goes way beyond medical misogyny. I think that's an unfair label, because what we found was a culture that infected the unit in Nottingham, and it wasn't just doctors. I need to be really clear about that.
So you're saying it's also midwifery? It's the midwives?
Well, I'm saying it was in Nottingham, there was a core of colleagues across all professions, not just doctors, not just midwives. Equally, there were some excellent staff who tried for years and years and years to speak out as far as the board, and they were not listened to.
Yeah. And there was also examples of midwives having to falsify records to get around their colleagues who, were trying to block them from bringing women into the units.
Absolutely.
Which is clearly, I mean, a completely mad situation to be happening. Stig asked the Minister earlier about what happened to some of the staff in these cases that we know about. And the question extends to the chief executives. I know for your report, you sought to speak to all of the executives in charge, and I think in at least half of those cases, they didn't engage with you. Is that good enough? Should we see people losing their jobs? Is that the stage this is now at?
So just to be absolutely clear, all of the current members of the executive team that we asked to speak to did engage with us, in a really honest and transparent way. The issue was with recent former executives who have held key positions during, the timeline of my review. It was around 50% of those colleagues came forward despite repeated chasing, and in some cases 3 letters to them from their current chief exec. So I do think that this is unacceptable, but I do know that Nottingham, Leeds and Sussex MPs are working together to make sure this can't happen for future reviews.
Are you disappointed in this report today?
I think that it's a useful summary of the long-term known issues, everything gathered into one place. Having done my very best to read it overnight since the embargo was lifted at about midnight, I don't see anything that I am surprised at. I am disappointed that, we're seeing the same themes over and over again, but it hasn't taught me anything new, sadly.
So I suppose the question is, and people are talking about you as being the perfect person to be this maternity commissioner, would you be prepared? Would you be willing to take on that role?
So that's an interesting question. I did sign the petition for the maternity commissioner. If you look, you'll find Donna Ockenden's name on it. I was supportive of it as a role. However, the excellent report that led to that recommendation was May 2024. And the issue is that time doesn't stand still. Maternity services have not improved in the last 2 years. And my concern now is, can one person actually fix this system? Where indeed I think it needs concerted, timely, urgent action from Secretary of State right down to the ground. Let's not wait any longer.
So you wouldn't rule it out, but you would be sceptical about how much you could really change if you were that commissioner, if you took on that role?
So what I'm saying is I understand where this role came from. You will know that I'm really rather busy with other reviews across the country, and I wouldn't want to be a failure because of lack of time or lack of focus or effort by others who should be doing more.
Donna Ockenden, thank you very much for joining us on the programme this morning.
Thank you.